Hello everyone, my name is Yar Flores, and today for my research proposal, I'll be looking to investigate dental fluorosis severity in rural Colorado. A quick overview of what will be presented is the background about dental fluorosis and fluorinated water, the current research in this field, the hypothesis, objectives, specific aims, and experimental design of the proposed study, as well as the anticipated results. To begin, dental fluorosis is the condition in which the enamel layer of the tooth becomes disturbed because of successive exposure to fluoride. It is characterized by lower mineral count on the enamel, leading to porosity as well as secondary staining on the affected tooth. To the left, we can observe the different categories in dental fluorosis. It can range from very mild to severe. What we can observe, however, is the porosity that also occurs on the tooth. The porosity occurs due to the fluoride affecting the enamel-forming cell ameloblast. This causes a dose-related disruption of the enamel mineralization, causing widening gaps in its crystalline structure. As you can imagine, having pores on the tooth is not very beneficial for the reason that bacteria tend to inhibit the spaces and affect overall oral health. Dental fluorosis can only occur when teeth are forming, and therefore fluoride exposure during childhood leads to this condition. Although the fluoride ion can lead to dental fluorosis, it is widely used in the dentistry field. The fluoride ion is used because of its benefits, one of them being its ability to prevent dental cavities by inhibiting bacterial metabolism on the enamel surface. So what is occurring can be explained on the picture by the left. To the left, we can observe how the fluoride ion replaces the hydroxyl group to form fluorapatite on the tooth enamel. Fluorapatite is what remineralizes the enamel layer and protects the tooth against cavities. What also occurs when fluorapatite forms is this acidification of the bacterial cytoplasm through the formation of the hydrogen ion and fluoride from hydrogen fluoride. What this acidification of the bacterial cytoplasm does is it lowers the pH, resulting in the bacteria using more energy to maintain a neutral pH. With the bacteria using more energy to maintain a neutral pH, it results in less energy to grow, reproduce, and generate acid, the one that causes cavities to the tooth. The fluoride ion is beneficial when used in moderation and is why we see it added in our water that we consume. Drinking water is the most important exposure pathway of fluoride. About 75 to 90% of fluoride intake is through the water we drink. The U.S. Public Health Service currently has the optimal fluoride concentration of 0.7 milligrams per liter. For the most part, the communities in the U.S. have water with fluoride at the optimal concentration. However, there is rural communities that depend on groundwater, and the issue with that is that groundwater contains higher amounts of fluoride. The reason why groundwater contains higher amounts of fluoride is because of the environment it's surrounded by. The concentration of fluoride in water varies depending on the minerals of rocks and ores present in the same location as water. The water interacts with these minerals around it and therefore leads to increase of fluoride concentration in the water. This becomes an issue because 6 million residents in the United States depend on this groundwater. There has been research showing that rural communities outside of the United States, drinking groundwater above the optimal dosage has led to about 47% of the children to be diagnosed with dental fluorosis. So if we take the 6 million residents in the United States depending on this groundwater, that is approximately under 3 million who have dental fluorosis, which is a very high percentage occurring in these rural communities and needs to be investigated. There seems to be a lack of literature available about dental fluorosis occurring in these rural communities and needs to be investigated. There is, however, research in many third world countries dependent on groundwater, such as Ethiopia. In this study, it was found that individuals using the Rift Valley water were experiencing dental fluorosis. The same could be occurring in these rural communities that they're exhibiting whatever degree of dental fluorosis, but we don't know that because there's that lack of literature available to us with this. Current research has also shown the treatment options for dental fluorosis. Currently, there is no treatment for this condition, and there's also been research in the self-perception in adults, which the research basically went and asked about the overall happiness of these individuals with dental fluorosis and found out that happiness tends to decrease as a child has dental fluorosis. So with that being said, it has led to the research question of how severe will dental fluorosis be in rural communities in Colorado dependent on water above the recommended fluoride concentration. So to answer this question, what this research wants to do is test dental fluorosis in rural communities in Colorado. The objective of this study would be test individuals' amount of dental fluorosis in rural community in Kingsburg, Colorado. Kingsburg is dependent on groundwater above the recommendation dosage of fluoride and will therefore be investigated to see the degree of fluorosis occurring within that community. With this research, there's also specific aims we'll be looking at, and these include the assessment, the assessed degree of dental fluorosis in individuals, assess the overall health, which includes the cavities, gingivitis, and pulp vitality test, and possible skeletal fluorosis occurring as well. So in this research, we are hypothesizing that due to the exceeding amount of fluoride in the groundwater of Kingsburg, Colorado, there will be a higher number of individuals with dental fluorosis, poor oral health, and possible skeletal fluorosis present when compared to adolescents in Pueblo, Colorado. The importance of this research. Why do we want to conduct this? The reason for this is that dental fluorosis affects approximately 41% of adolescents aged 12 to 15 in the United States. This is of concern because there is currently no treatment for dental fluorosis, meaning these individuals will have the secondary staining for the rest of their life. The teeth become weakened and suffer permanent physical damage due to dental fluorosis occurring, and this may lead to other oral health issues in the future. This can also be very costly to the individual psychosocial suffering that affects his or her happiness, as mentioned as well. The individual may be concerned about the way his smile looks due to the dental fluorosis occurring. And dental fluorosis may serve as a visual indicator of other potential problems such as skeletal fluorosis. So what skeletal fluorosis is the hardening of the bone due to high concentration of fluoride as well. Currently with skeletal fluorosis, there's a physical test, but it's mainly dependent on the individual's response to the physical test. What we expect to find is to see if there's a correlation between dental fluorosis occurring and skeletal fluorosis. So then that way, instead of the physical test, we could just visually look at the teeth and say, if he has dental fluorosis, he has to have skeletal fluorosis as well. So now the experimental design of this research. How this research will be conducted is we will test 20 individuals in Kingsburg, Colorado. They will be randomly selected between the age of 12 to 15. And Kingsburg, Colorado will serve as the experimental group. And the reason for this is that in Kingsburg, Colorado, they are very dependent on groundwater. We could see that they have 6 main wells in their community, and that many people use these wells as their main source of water. And the reason for this, that it's going to be an experimental group as well, is because the groundwater is above the optimal dosage, being at 3.5 milligrams per liter. In this study, the control group will be the 20 individuals in Pueblo, Colorado, age 12 to 15. And the reason why it's going to be the control group is because Pueblo, Colorado's water is actually the recommended dosage. So we're not expecting to see any dental fluorosis occurring in these individuals. To exclude any other variables interrupting the study, we will exclude adolescents consuming more than 3 milligrams of fluoride in their diets. We will also exclude adolescents who do not use proper hygiene, such as brushing their teeth twice a day. To do our specific to accomplish our specific aims of the study, specific aim 1, examine the degree of dental fluorosis. An HT Dean index will be used to examine the degree of dental fluorosis occurring in both the individuals from Kingsburg, Colorado, as well as Pueblo, Colorado. Comparison of the teeth with the index by the hygienist will be conducted under polarized light and light microscope analysis. The data will be recorded and averaged for each of the towns. To accomplish our aim 2, which is the overall oral health of adolescents, the adolescents' number of cavities will be measured. The test for gingivitis will be conducted, as well as pulp vitality tests will be conducted. The oral health of mouth will be conducted by a dental hygienist using a probe to test the degree of gingivitis occurring within the individual, and a full mouth x-rays will be taken to see how many cavities are occurring with these individuals as well. And for the pulp vitality test, what we will be doing is using a cold and hot stimulus on the tooth to see how the pulp responds to it. And lastly, to accomplish our aim 3 of skeletal fluorosis in adolescents, a physical test will be used as well as X-ray radiography to test for dental fluorosis, to test for skeletal fluorosis occurring. We will use a dental hygienist for this as well. What will we record will be the HTD index values for the teeth, the number of cavities, gingivitis, pulp vitality, and degree of skeletal fluorosis. All this data will be averaged for Kingsburg as well as Pueblo, Colorado individuals. The data will be analyzed by doing an independent samples t-test at a 95% confidence interval to see if there is a significance in dental fluorosis between the two communities. The t-test will be conducted for each specific aim. So for example, we will average the data of dental fluorosis occurring in Kingsburg and Pueblo, Colorado, and use a t-test specifically for that aim. What we are anticipating by doing this research is that adolescents in Kingsburg, Colorado will have a higher degree of dental fluorosis. The reason for this is their exposure to the higher concentration of fluoride. What we're expecting to see is that adults in Pueblo are expected to show little to no dental fluorosis occurring, serving as their control. We are also expecting to see Kingsburg demonstrate lower oral health when compared to the individual from Colorado, and this is due to us expected to see people from Kingsburg, Colorado, to have dental fluorosis. Lastly, the study is expecting to see skeletal fluorosis occurring in individuals as well in Kingsburg, Colorado, but not in Pueblo, Colorado. Once this research is conducted, further research can be conducted to further improve the study. One of them being is seeing if the diet has an effect on the degree of dental fluorosis occurring in individuals. Instead of excluding individuals who consume more than 3 milligrams of fluoride a day, they will be included to see how that affects dental fluorosis occurring in an individual. Finally, to conclude the significance, what happens next? Why are we doing this? The reason why is with this study, we are able to see the degree of dental fluorosis and oral health in rural Colorado. We are able to prevent this permanent condition in children. And lastly, highlight the importance of using optimal fluoride dosage water. If you have any questions, feel free to ask. Other than that, thank you for listening.